Nurse Fedden. My name's Robin, and I'm a level 1 student nurse.
Hi, how you doing, Robin?
I'm doing all right. I know that you're working on a patient right now, and I was just wondering if I could get SBAR.
Sure. This is room 622, and we're going to be working with Ronald Jarvis. He's a 67-year-old white male. He's 5'11", 171 pounds. He has a non-healing stage 2 diabetic ulcer. He's also type 1 diabetes mellitus. The past 5 days he's consistently had glucose readings in the 300s. He's been diabetic for 20 years. Till 3 weeks ago, the patient has been running consistent glucoses in the 120s, so he came in to get it checked out. He denies any significant previous illness. His previous vital signs were 98.4 Fahrenheit, respiration was 18, pulse 80, blood pressure was 145/72, and 95% oxygen saturation on room air. He's oriented ×3, and S1, S2 sounds were appreciated without a murmur. And that's pretty much it. Everything else looks good.
Cool. Are you going to be giving him any medications?
Yeah, he's getting insulin. His last glucose reading was 241, so he will be getting insulin today.
Okay, so why are they getting insulin specifically?
Well, he's getting insulin because he's type 1 diabetic.
Oh, that makes sense. So what action does the insulin have on the body?
It inhibits the breakdown of glucose, fat, and amino acids. It also lowers glucose concentrations, and it helps with the uptake of glucose into the muscle and adipose tissue.
Okay. So when should you question giving that medication?
Well, you would question it if the patient is hypoglycemic, or if they have a fever, a thyroid disease, or an infection, or recently had trauma or surgery.
Okay. Does it have a therapeutic serum level?
No, there's no therapeutic serum level.
And what sort of vital signs are you looking at when you're getting ready to give this?
Well, they're not really vital signs, but you would definitely check the glucose, and you would want to check for temperature.
Okay. So what physiological parameters which ones do they
Physiologically, again, you would check temperature, peripheral nerve sensation for neuropathy, which is often associated with diabetes. Respirations, and monitor for diarrhea or vomiting, which is a sign of hypoglycemia.
What interventions do you have to teach the client to ensure that the med administration is safe in a hospital setting?
In a hospital setting, you want to make sure that the client knows what medications they're taking, what they look like, and the amount, so that if inadvertently the patient was offered the wrong medication, they'd be able to be that final check and let you know.
Okay. And what interventions need to be taught to the patient for taking the medication safely at home?
In the home setting, you want the patient to be able to properly administer the medication. You'd also want them to know any adverse side effects to be able to look out for, and any contraindications that they may come up when not to take the medication.
Oh, okay. And what are the side effects and potential adverse reactions?
Well, the most common is hypoglycemia, but you can also get hypokalemia as well.
And then how do you know the medication is effective?
Really, you know the medication is effective when you're monitoring the glucose level and you see it trending back down into a normal range.
Okay, cool. That's all I have for you for now.
All right. All right. How you doing, Mr. Jarvis?
I'm okay. How are you?
Not too bad. We're going to be giving you some insulin today.
Okay.
And I've got here some information. I know you wanted some information on the diabetic diet.
Oh, thank you.
You're welcome. And I just need to scan your bracelet as soon as I pull this up. Can you go ahead and give me your full name?
Ronald Jarvis.
And your age?
67.
And the last 4 of your social?
9264.
All right. And let's get this ready. All right. double click that. Let's do that again. There we go.
So what was my last sugar reading?
It was 241.
Oh, that's a little high.
Yes, it is. But we're going to get that straightened out. Okay. Go ahead. Glow up too. All right. Do you have any questions for me?
Well, so you think this medication's going to help me?
Absolutely. Insulin should do the trick for you. We're going to clean the top. And this is the Glargine that I'm going to give you. And you're getting 18 units today.
Okay.
And I'm just going to draw up 18 units of air to inject into the vial. I'm going to check that out for a second set of eyes.
Yep, it's 18.
Okay. Okay. And I'm going to, oh, I threw it away. Going to go ahead and clean you. And where was the last place you had the insulin administered?
On the left side of my stomach.
The left side? Okay. So we're going to go ahead and do the right side then. I'm just going to give it a little pinch. Okay, I'm going to go in 90-degree angle.
Ow.
Two, three, four, five. And then I'm going to throw it away.
I guess that wasn't too bad.
Yeah, that's not bad. We're going to have to give you one more. It looks like you're going to get some regular insulin as well. And let's go ahead and check out the sliding scale on this.
Why am I getting 2?
That's what's in the orders for you. One's a long-term insulin, the other one's a shorter term, so it'll give you a baseline level, then the shorter term will help it with any peaks.
Oh, okay.
And I'm going to have to scan your wrist again. Well, as soon as I click in here. Let's try that one more time. All right. There we go. Okay. And I'm going to go ahead and clean this insulin vial. And according to this, at 241, you're going to get 12 units of insulin.
Okay.
Okay. Do you want to check that out?
Yep, looks like Tom.
Okay, we're just going to move that injection site over a little bit. I can still go in at 90 degrees. Good.
That one didn't hurt at all.
Well, that's good. I'm going to go ahead and save this. And here's your call light.
Oh, thank you.
And if there's anything else you need, just let me know.
All right, thank you very much, and thank you for the literature.
You're welcome. You have a good day, and I'll check in on you in a little bit.
Thanks for letting me watch.
No problem.
So were there any pertinent pieces of information you reviewed before giving the medication to the patient?
Yeah, I reviewed the blood glucose levels to make sure I was giving the proper amount of insulin.
Oh, okay. So did that information affect your decision to administer the medication?
Yes, the results of the glucose test essentially told me how much insulin to give.
Was there any information that changed how you gave the medication?
Yeah, when I asked the client where where his last injection site was, that told me that I needed to go to a different site because you don't want to build up any scar tissue by injecting in the same place again and again, because then you get insulin resistance.
Oh, okay. Cool. I think that's all the questions I have, so I'll be down the hallway. If you need
All right,
anything,
it's
let me
nice
know.
working with you.
Thank you so much, Nurse
Good luck in
Bennett.
level 1.
Thanks.